Over 56% of people are not consuming enough thiamine or vitamin B1 in their diet. Why this is so important is because we can't synthesize it. We're totally dependent upon dietary intake. Not only that, but thiamine, B1, is depleted by stress, inflammation, and poor gut health. This can lead to a self-feeding cycle wherein a lack of B1 in the diet is compounded by SIBO or fungal overgrowth. And then these, as they deplete thiamine, actually alter motility and can further worsen problems in the gut. And so it's probably no surprise that this is a somewhat common deficiency, but it also seems to be overlooked. And part of this is because testing is notoriously inaccurate. So health officials, if you will, are a little bit at a loss for how do we quantify this. But let's have the discussion today so that if there is a simple vitamin solution to some of the gastrointestinal and neurological symptoms that might be plaguing you, then we can point you in the right direction along with a protocol. So to start, let's answer the question, are you getting enough? 2011 NHANES data, looking at over 16,000 individuals, assessed the nutrient intake of thiamine in the diet. And they found that 56.3% were not consuming enough dietary thiamine, which is probably why a 2021 review paper commented as follows. A large body of evidence dating back decades suggests thiamine deficiency is neither rare nor limited to traditionally defined populations, but that it is simply under-recognized. As a little bit of context, vitamin B1 was actually the first vitamin ever discovered. It functions to allow the mitochondria, partially via the Krebs cycle, to make energy, so cellular energy production. It also has important functions for the immune system. Think innate immunity on the one hand, so this is the barrier of the gut, but then also adaptive or antibody production, B cells and T cells on the other. And in addition to all of this, it's crucially important for the nervous system because to make this chief neurotransmitter, acetylcholine, we need thiamine, vitamin B1. And this might be part of the reason why we see a number of symptoms, but they tend to consolidate to two systems we talk a lot about, the gut and the brain, or the brain and the second brain, as it's also called. Digestively, poor appetite, indigestion, heartburn, nausea, vomiting, abdominal pain, bloating, constipation, and food intolerances. Again, thinking that a lack of acetylcholine doesn't allow things to move through the GI tract at the appropriate pace. So this is where you get things like indigestion. But then also knowing that innate immunity and the barrier of the gut therein requires thiamine, we get the leaky gut and sort of inflammation of the intestinal tract. Now, coming up to the brain, the primary brain, neurological symptoms include fatigue, brain fog, irritability, mood swings, neuropathies or tingling, memory loss, and even disturbances in sleep. Another question we should think about is, are you depleting what you already have? Maybe you're not in that 56%. Maybe you're getting enough. That's not the complete story because there are things that can actually accelerate depletion even in what you are already consuming. This study from 2001 was very telling. What they did was have subjects consume progressively higher levels of carbohydrate in their diet. They found correspondingly for every interval increase of carbohydrate in the diet, a lowering of thiamine in either the urine or the plasma. In fact, this is kind of how thiamine or vitamin B1 deficiency was initially discovered in Japan when they started polishing or making the brown rice into white rice and removing the husks. The husks contained the majority of the thiamine. And this is where we first see beriberi and vitamin B1 deficiency pop up due to that population having a high consumption of carbs, but now doing so in more of a processed rice format, and rampant thiamine deficiency followed. Processed food is also another way in which you can deplete thiamine. as are the consumption of alcohol, coffee, and tea. Now, I'm not saying that you can't have any alcohol, coffee, or tea, but think about this. If your dietary carb intake is kind of high, that's pushing you toward deficiency. If you consume a lot of coffee, a lot of alcohol, right, all these things are pushing you further in that direction of thiamine deficiency. Now, I want to come to this other concept of secondary deficiency. And really quick, before we do, please comment, like, and subscribe. This helps us reach and hopefully enlighten more people about how they can improve their health. Secondary deficiency. This is what I think is probably more common in a cohort of people like us who care about their health, who probably tend to their diet, maybe use supplements, but they're proactive, right? So the likelihood of a overt dietary insufficiency is lower, but in the people who have some chronic symptoms, whether it be small intestinal bacterial overgrowth or chronic bloating or abdominal pain or suspected Candida or an inflammatory condition of unknown diagnosis, this is where I think we run the highest risk of deficiency due to secondary deficiency. So it's deficiency of thiamine secondary to something that's taxing the body's ability to, or the body's stores of thiamine. It's been well documented, and I want to thank Elliot Overton for making me aware of this, that across plants, animals, and humans, stress will universally deplete thiamine. Plants can upregulate in times of stress their thiamine production, but like we covered before, humans are completely dependent upon dietary intake. So this is where the situation, I think, gets a little bit more dire in the sense that when something like poor gut health is present, you are at a heightened risk not only for malabsorption, but also, let's take Candida as one example. Candida produces this metabolic byproduct called acetaldehyde. That acetaldehyde, which can cause things like brain fog and fatigue, requires more vitamin B1 in order to metabolize it. SIBO, look at this study I thought was fascinating. 2008. This was in a cohort of people who were post-gastric bypass, and they developed SIBO. What was fascinating here was that thiamine supplementation was ineffective at restoring thiamine until the SIBO, or the small intestinal bacterial overgrowth, was treated, really underscoring the importance of gut health for vitamin status, specifically thiamine. And I think what happens here is people can get caught in this cycle where they develop SIBO. This reduces the absorption of thiamine, but thiamine, remembering, because it stimulates or allows the release of acetylcholine, and acetylcholine stimulates motility, and when people have slow motility, they're at risk for SIBO, there can be this cell-perpetuating cycle. One other study I found enlightening here, it's an older study from 1942, but nevertheless, these researchers took 11 women, put them on a low thiamine diet, and they all developed reduced appetite, nausea, vomiting, indigestion, and constipation. So what's so interesting about this study is at baseline, none of these symptoms were present, but only after weeks of thiamine restriction did they pop up. So another data point showing us that if intake is insufficient, we can start to have gastrointestinal symptoms, which is why I want to share this information so that if you're doing the other things to improve your gut health, let's say you're avoiding food triggers, you're using a probiotic, what have you, right? There's a whole cast of things that can be used to improve gut health, but the needle is insufficiently moving, so to speak, then thiamine deficiency might be the culprit. And there's another component here that I think is not yet very well understood, but it's in chronic infection. Now, this is partially my speculation, but I want to cite a study from Erdman that found when people had 3 or more digestive symptoms, they were at heightened risk of having a vector-borne infection, which we've been discussing on the podcast, has a antiquated label of Lyme. But as we're learning more about these organisms, we're learning there are other organisms that are more common and are treated differently, but have only recently been available to test via somewhat accurate testing. The point I want to make is here are the symptoms that increase the risk of one of these infections being present. nausea and vomiting, indigestion, heartburn, constipation, food intolerances. Does that sound familiar? So it makes me wonder if there's this sort of assortment of etiology, if you will, in the sense that they have an infection, the infection's causing some symptoms, but the infection is also taxing thiamine reserves, again, leading to a compounding effect similar to what we saw and discussed in SIBO. There's also the brain-gut connection, and we've alluded to this, but I just wanted to make a few more remarks. The vagus nerve, this is the chief intervention from the brain to the body that is parasympathetic, but also pro-motility. And again, remember that without adequate dietary thiamine, the body cannot make acetylcholine, which is a chief neurotransmitter that the vagus nerve uses to stimulate motility. In fact, prokinetics like ginger or even prucalopride, which is quite effective as a prokinetic, they facilitate in part acetylcholine, which is how they have their pro-motility stimulus. So just bear that in mind. And one other study I wanted to cite here, 2018, they found that low vagal tone was associated with gastrointestinal conditions. Quoting, "We found that participants with vagal dysfunction, so dysfunction of the vagus nerve, had delayed gastric emptying and higher prevalence of SIBO, small intestinal bacterial overgrowth." So what might be happening in some of these individuals is a thiamine deficiency is what is underlying that lack of tone or functionality in the vagus nerve. So then this brings up the question, I think very reasonably, how do you know if you're deficient? And unfortunately, neither plasma nor serum blood testing is very accurate. Quoting the NIH, "Levels of thiamine in the blood are not reliable indicators of thiamine status." The clinical clues are probably the most important, especially when considering that thiamine is inexpensive and extremely safe. I think the most practical way to approach this is look for clinical signs that thiamine deficiency might be present, and then perform a therapeutic trial on thiamine and see if said symptoms improve. We mentioned a number of those symptoms, but for a bit of context, remember those symptoms in and of themselves, so the fatigue, the brain fog, the dysmotility, the constipation, the reflux, the food reactivity, right? All of these things are not necessarily going to guarantee thiamine deficiency, but if they occur in the context of someone who has treated SIBO, they're on an elimination diet, they're doing all the things for fatigue, meaning they're eating enough, they have been exercising, sleeping adequate, and they still have these symptoms. That is what I think the presentation most demonstrative of thiamine deficiency is. This reminds me of someone I was consulting with. This is probably about 3 months ago. This was such a bullseye red flag, if you will, for thiamine deficiency. He said, Doc, every time I have a lot of white rice, I get tingling and numbness in my fingers, right? So again, remember that we discussed that carbohydrate, especially a big bolus, will reduce thiamine status in stores. That's one potential indicator that someone could have thiamine deficiency, especially if you're seeing that a higher carb intake directly elicits symptoms. So let's come to the protocol. And there's a few different ways to come at this, but starting with the real summary, the dosages used across studies have ranged from 10 milligrams per day up through 3,000 milligrams per day for a duration of 1 month to 2 years. So that's pretty broad, and we'll give some more specifics in 1 second, but I did want to take just a moment to cover what some of the interventional research studies have found. Because it is important when we have it to cross-reference interventional data in humans to make sure that the hypothesis has been tested and we have at least some assurances that there's efficacy. And this is what you're seeing in the graphic. There's a number of studies that we've listed here, 24 in total, different forms of thiamine, whether it be thiamine HCl, benfotiamine, and we'll talk about this more in a moment, or TTFD, different forms, different dosages, but here's what I wanted to really flag for you. We have interventional trials showing improvements in all of these conditions. I'll just hit a few, but inflammatory bowel disease, in fatigue, in vagal tone, as we discussed a moment ago, exercise tolerance, mood, cognition, and again in fatigue. So we do have data showing that administration of thiamine can improve various conditions or disease states. Now, coming back to that remark about testing, because I think it's always an understandable question. Well, next time I do a blood panel, can I ask my doctor to check off a box for thiamine? This is one study that I think really demonstrates that normal blood thiamine will not be instructive to whether or not you should try thiamine. This was a 2022 randomized control trial in patients who had inflammatory bowel disease and corresponding fatigue. They were all given thiamine. Fatigue was improved in anywhere between 55 to 75% of the individuals. But here's the kicker. They didn't find that the baseline levels of blood thiamine, when they did the blood test, predicted if people would see improvements in their fatigue, meaning both people with lower thiamine and normal thiamine could have improvements in their fatigue when administered thiamine. And this is probably because the blood testing is only going to give you a snapshot of recent dietary intake. It's not going to be adequate to assess stores. So it's nice to have a biomarker like vitamin D that can tell you if you're low in vitamin D and you should supplement. Unfortunately, with thiamine, again, the presentation, the clinical clues is really what should guide the decision-making here. And then one more study I thought was interesting. This was a 2014 clinical trial in patients with type 2 diabetes. They actually found improvements in vagal tone as assessed by heart rate variability when they administered thiamine. It's been a while since we've discussed HRV or heart rate variability, but this is one measure of the health or the balance of your nervous system. If you do have a healthy nervous system, you should have a lot of variability in your HRV. But if someone's a little bit dysautonomic, meaning the balance between the parasympathetic and the sympathetic is not healthy, they tend to be oftentimes more so stuck sympathetic, and therefore they have a very narrow band of variability in their heart rate. So anyway, just another data point showing us that, yeah, we can have improvements in vagal tone and HRV by simply using the vitamin thiamine. And as we transition to the protocol here, I did want to lead with just a couple clinical anecdotes, hopefully to help give any further precision or direction to you who are watching or listening to this. Elliot Overton shares a really interesting case study of someone who had inflammatory bowel disease, went into complete remission with 2,000 milligrams per day of thiamine. And then from our clinic, Dr. Scott had a few thoughts about a recent case he wanted to share.
Mary was a 55-year-old female who was experiencing symptoms of feeling full quickly, lack of appetite and taste, belching, brain fog. And she had previously tried stomach acid support, probiotics, herbal antimicrobials, and none of those things really did anything for her symptoms. Nothing got better. So she started on the thiamine protocol, and initially thiamine led to a temporary worsening of all of her digestive symptoms for roughly a week. And then after that period of time, she started to see an improvement in symptoms, and then she would increase the dose. Symptoms would get a little bit worse. She repeated that cycle a few times through, and then until she got to the point of, essentially, she said that she felt so much better. Her brain fog was the first symptom to go away and resolve. She got her taste back. She's having less belching, and her appetite is much better overall.
And I'll also just add another recent observation from the clinic with someone I was working with, a female patient who remarked every time she goes on the thiamine protocol, she has essentially normal levels of energy. You know, she essentially remarked, gosh, I feel great every time I go on the thiamine protocol. Now, this brings up another, admittedly, a little bit of a tangent, but, and again, credit to Elliot Overton, who's really just done a phenomenal job studying this topic for years and years and years, which is why I continue to reference him. He's also been on the podcast a while back, and I found the conversation there very insightful. One of the things he mentioned was there can be two groups of people, those who need thiamine to replete a deficiency, and those who need thiamine almost like an ongoing drug. And it's the people who, every time they come off the thiamine, they regress, who never seem to maintain sufficiency, that might be in this cohort of needing thiamine like a drug. Now, I would add one thing to this, wherein my suspicion, this is just my suspicion, this may change over time, is that those people, most of those people may, or a subset, may not actually need thiamine ongoing as a drug, so to speak. They may be using thiamine to help replete a secondary deficiency that's coming from some sort of chronic infection or inflammatory burden. And so the reason why they just can't ever seem to replete their stores is because the source of active thiamine depletion has not yet been addressed. So just something to think about in terms of if you're dependent upon a vitamin or an antimicrobial, there might be something that you've missed. Okay, so let's come to the protocol. And again, I want to credit and thank Elliot Overton for putting a lot of this together. I'm just sharing it with you. Again, a lot of this has been taken from him. There are 3 general forms of thiamine. Thiamine HCl, that's going to have the lowest bioavailability. Benfotiamine, which will have high bioavailability, and TTFD, which also has high bioavailability. Now, with thiamine HCl, the dose that can be used is anywhere from 100 to 2,000 milligrams per day. With the benfotiamine, anywhere between 150 and 1,200 milligrams per day. And with the TTFD, because it's so bioavailable, 50 to 500 milligrams per day. And the general approach is to use a combination of these, but these are the target ranges for each individual. And really the one thing to be the most aware of is with the TTFD form, you shouldn't go much above 500 milligrams per day. And that leads to the phasing protocol, if you will, because we do want to sort of work our way onto thiamine gradually. Week 1, your total dose across these 3 different forms of thiamine of B1 would be 400 milligrams per day. Then week 2 to 3, you can escalate to anywhere between 600 and 1,200 milligrams per day. And then the final leg here, weeks 4 to 8, 1,600 to 2,000 milligrams per day. I also wanted to cover some food sources. Pork loin is a great source of thiamine. Other good sources, black beans, fortified breads and rices, Atlantic salmon, pecans, brown rice, not white rice, lentils, whole wheat bread, long grain rice, milk or plain yogurt, and liver and organ meats. I would also recommend the wonderful book, Nutrivore, where she has wonderful resources for how to obtain the most nutrient density from your diet, including but not limited to thiamine. One of the final things I wanted to discuss was safety and troubleshooting. Thiamine is very safe. However, it's been somewhat well identified what's known as a paradoxical reaction, where when going on to a higher dose, a repletion protocol, people can have a temporary worsening of their symptoms. Now, this is not die-off, because die-off occurs when we use some sort of killing agent, correctly labeled a paradoxical response, wherein people may notice they're more tired or their digestion seems to get a little bit worse. This is important to bear in mind because this actually might be a good sign that you need the thiamine and the thiamine is working. According to Overton, it tends to occur in those who are more severely deficient. In fact, we did have someone, this is another one of Dr. Scott's cases, who noticed every time she increased her dose, I think it was her constipation, if I'm recalling correctly, got worse for a few days. Then it got better. And then a week or so later, when she upped her dose again, the same cycle repeated itself. So just keep that in mind and go low and slow. It's not a race. And this is where I think the gradual increasing of the dose is going to be better and more advisable than trying to go right to the high dose. This negative symptom flaring, this paradoxical response, may last anywhere from a few days to a few weeks. If it's a few weeks, that's probably a good sign that you want to back off the dose. So I would give it a few days, and if after 2, 3, 4 days you're not seeing the symptoms abate, that may tell you that the dose is just too aggressive, so back it off slightly. And then what do you do if you don't respond? Well, if you've worked your way up to 2,000 milligrams per day and you've done this for about 4 weeks and you have not seen improvements, then thiamine deficiency is probably not the problem. And there are some other things to consider: SIBO, Candida, a vector-borne infection, mold, hypothyroidism, B12 deficiency, and potentially mitochondrial dysfunction. So this is something that is inexpensive to do. We've given you the clinical clues that a trial might be warranted, some protocols to experiment with. Always a good idea to check in with your healthcare provider. But if this resonates, then I'm very curious to hear in the comment section how the protocol goes for you. In the close, I want to leave you with a quote from Dante: "The secret of getting things done is to act." So keep experimenting with your health. Don't give up. Keep trying. Keep making changes. And before you know it, you'll be feeling much better. Alrighty, this is Dr. Ruscio. Talk to you next time.